Welcome, folks. It's another episode of the SAK Show, proudly brought to you by MacCoffee. And today our location partner is Kingfisher's Nest. Do come and check them out as you enjoy your MacCoffee. As you can see, I am trying to get my hand sanitizer over here. You know what all this is about. But we've got three professionals who are going to give us more insights, more information, and more knowledge about an epidemic that has taken the country by storm. Dr. Mujahid, Professor Reena, and Dr. Swati, welcome to the show.
Thank you very much.
Thank you so much for coming over here. And you know, it's a ritual. When we start, we have to get a brief introductions about yourself. So we can start with Professor.
Thank you, SAK, for inviting us to discuss this really important topic. My name is Professor Reena Shah. I'm a professor of infectious diseases at the Aga Khan Hospital, Nairobi.
Dr. Mujahid.
Yeah, thanks, Shaheed. Yes, my name is Dr. Mujahid. I'm a consultant ear, nose and throat surgeon and also based at the Aga Khan University Hospital, Nairobi.
Thank you. Dr. Swati.
I'm Dr. Swati Das. I'm a consultant pulmonologist based in Aga Khan Hospital.
Nice. So, you know, we are all here to talk about the COVID-19 or the coronavirus and everything. What is COVID-19 or what is coronavirus? Is it just the words are the same? It means the same, or is it? I'm the layman over here, so you guys can guide me on this. What exactly is this epidemic?
So the coronavirus it comes from a family of RNA viruses. It's called corona because when you look at it under a microscope, it looks like a crown. It has protein spikes that make it look like a crown. So that's why the name corona was coined. The coronaviruses have been around for some time. In 40 years ago, people got coronaviruses and they presented like a normal upper respiratory tract infection, the normal flu that we get, and they get better. But in the last 20 years, we've had two outbreaks of the coronavirus. One is the SARS, the Severe Acute Respiratory Distress Syndrome, SARS virus, which in 2002 was in the Far East, Singapore, China. And then since then in 2012, we had the MERS. The SARS coronavirus 2, which is the current one causing the epidemic, was found in Wuhan in 2019. So it's a very recent virus. The virus causes the disease, which we call COVID.
Okay.
So that's a difference. So the virus is SARS coronavirus 2, and the disease you get is COVID-19.
Wow. Okay. And
so that's a difference.
Would it be correct to say that it is like a flu? It is a flu.
So the flu is caused by a virus called the influenza virus, and the influenza virus has been around for a long time. There's a lot of similarities between the two viruses in terms of the way they present. So you get fever, shortness of breath, difficulty in breathing, cough. So both viruses get that. But the issue we're having now with the coronavirus is how quickly it's spreading. Okay. So for every one person that gets the coronavirus, 3 to 5 other people get infected. Wow. As opposed to the flu virus, where if one gets infected, it's about 1.5. So it's like a wildfire. Oh. You know, so if people get it, it's just spreading through communities that have the epidemic currently. We're in the early stage of epidemic, but the ones that have it, it's spreading like wildfire. So that is the difference between the two. The other main difference is influenza has a vaccine, and we know how to manage influenza as opposed to the coronavirus.
Dr. Mujahid, what about the symptoms of the COVID-19? How would they differentiate? Once again, I know she's mentioning, but you can shed some more light on it from influenza.
Indeed. The coronavirus is like any other virus that causes upper respiratory tract infections. And what is commonly called flu or a common cold presents with a number of common symptoms such as fever, dry cough. I think dry cough has been emphasized a lot even in the media, that it's not something that you remove a lot of sputum. You may get sore throat and malaise. I think a person feels very ill generally, and that malaise is out of proportion sometimes of the what you expect in a normal common cold. This is the initial presentation, and most patients in the initial presentation are indistinguishable from anyone else who has a common cold. But if the virus sort of gets hold in the deeper respiratory tract, then the person may in fact develop shortness of breath, which is a very important marker, because if someone has shortness of breath, it means now the infection has gone to the deeper areas. Then it can lead to more serious complications. But I think the message which our viewers need to understand is that in the early stages, it is same like a common cold.
So how does it spread, Dr. Swati?
Till now, it is proven that it spreads by droplet infections. Suppose somebody has the virus and coughing, and the droplets, they fall on the surfaces and somebody else touches it, then it can spread. But if you have in a close contact with a person who has the virus, like a short distance, like you and me, we are sitting, the droplets can just go to your mouth, and then you can get mouth, nose and things. So mostly it is droplet infections. So that's why we are telling to avoid touching surfaces and touching your face, nose and all. And that's where come the hand washing things and cleaning things.
And is it like contagious very far apart from the droplets, like sharing of a cup or something?
If the droplets are fallen there on the table, or you are touching the phone and somebody else is touching, yes, it can spread like that. Yeah.
And tell me, Professor Reena, what can a person do to protect themselves? Because I think, the droplets falling off and all, it's something you don't foresee it coming, and you won't even know if you've already dropped the droplets.
Yeah. So it's if you know somebody who's had the coronavirus, right? You've got to make sure there's a distance from it. So there are many ways. So currently in our epidemic, we've moved to social isolation. So because we know the epidemic is going to come to our country, we stay away from people. So large social gatherings, weddings, all that gets cancelled. If once somebody has had exposure, so for example, if you've come from a country that has a virus and you've come into Kenya, you need to self-quarantine yourself, so you don't get the virus. But we know that you need to be at a distance of 2 meters to get the virus. So distance, so we call it social distancing, but it's actually positional distancing from the person. So if somebody has the virus, a distance reduces your risk of infection. Of course, for us healthcare workers, looking after, there's all the other masks and the PPEs that come in that we do use, and our hospitals institute those measures. Currently, it's only our recommendation is only the person who has the infection that wears the mask, rather than everybody else, because that's a common question. Can we prevent ourselves getting the infection if we wear the mask? And that's not true.
So how do you identify if a person has that? I know the symptoms and all are there, but isn't that a tricky?
It's a very tricky
position,
one.
right?
It's a very tricky one, and that's why instead of saying only the people who are sick don't go out, it's been said that everybody reduces their social interactions.
And who is, Dr. Swati? I think you can answer that. Who is at the most risk of this virus?
The risk is to everybody, but mostly the people who are getting the coronavirus diseases are diabetics, those who have heart problems, hypertension, that is blood pressure, high blood pressure, those patients who have lung problems like asthma, COPD.
Okay, is there age bracket over there?
Yeah, above 60 to 65 years. Some countries tell 60, some people tell 65, and those who are immunosuppressed, they get more of this.
Low immune system.
Yeah, low immune system, either cancer or some other immunosuppression people, they get more severe disease.
Dr. Mujahid, we are, I'm one of them, whenever you fall sick, nothing works, I have to take antibiotics, That's the only way I'll recover very fast. And do antibiotics work for the corona?
I think I must emphasize that this is a big fat no.
No, okay.
Because any viral infection, the word antibiotic means usually antimicrobial, but in our common context, it means something that works against bacteria.
Okay.
And since we are dealing with a disease that is not caused by a bacteria, it's caused by a virus, antibiotics cannot be used to treat it. Having had said that, there may be situations in which someone is very ill and is in a hospital setup where antibiotics may be used for other infections in a patient who has COVID.
Okay.
But it is not a primary treatment. I think that message should be crystal clear to all our viewers.
So what would be the treatment for it as such?
Yes, that's a big question. I think it's
Yeah.
$1 million
Yes,
question,
yes.
actually $1 billion
Yeah.
question. There is at the moment no fixed treatment. The good news is that up to 97% of cases would recover if they had the infection. The 3% who may succumb would be the ones who got the serious aspect of the illness. Now, in such patients, various regimes are being tried all over the world, including antiviral therapies. And you may have heard, and some of our viewers may have heard, that even some of the antivirals that have been traditionally used for HIV disease have been tried, and people have been trying some novel combinations, and some workers are reporting some degree of success. However, at the moment,
So
all
no
the
vaccine, nothing yet concrete.
I think we can come to vaccine a bit later, but there is no clear-cut definitive treatment. You can only give supportive treatment.
Wow.
For the person who gets the initial infection, you just probably have to take plenty of fluids, rest, isolate yourself, maybe some analgesic such as paracetamol, and then you have to wait.
Don't you think isolating yourself would just make it worse, and you might get into depression or something like that?
Well, I think the question is that which is at a bigger risk, one person getting depressed or him spreading it to 100 other people.
Sure.
So I think isolation, we mean it's a medical isolation.
And
You
it's
can
like
still interact with
so
people.
So it's more of a self-healing kind of a process.
Yes.
And that has been working so far.
Yeah. I think you mentioned vaccines. Perhaps maybe Reena, you can talk a bit about the vaccine.
So the vaccine trial has started in the world, but the vaccine trial has many phases. So first they develop a vaccine and it's tried on normal volunteers.
Wow.
So that's the first phase, and then they look at the side effects, they look at the efficacy, they see the antibody build-up. Then it moves to phase 2, phase 3, phase 4. It's still in phase 1. So right now what has started, and again the social media is wild about it at the moment. It's just been tried on healthy volunteers now. So I don't think it's gone anywhere.
It's not yet,
if I can just add to the treatment, there are lots of studies looking at different drugs, antivirals. There's remdesivir, there's the antiretrovirals, the lopinavir, ritonavir. We're actually waiting for the results from other countries that have had the mature epidemic to see what the outcomes are. But I agree with Mujahid, the main thing that saves you now is good supportive care. By supportive care is if you can't breathe, you put on a ventilator, if your kidneys don't work, you put on dialysis. But majority of the people do not need it.
And Reena, isn't it true that the vaccine is probably at the earliest several months away? Is that correct?
Oh, maybe even longer.
Maybe even
longer,
yeah. Because there's a lot of unfortunate media attention about someone who developed a vaccine in 3 days. I mean, I think this is misleading the public. And this is, I think, really almost criminal to perpetuate some of this false news.
Wow. Dr. Swati, would it be, what about pets, animals? Can you get it from your pet?
The virus is a zoonotic virus. It has come from the animals, but it has not been proven that the pets can give you the disease. Only one case report was there in Hong Kong, but it's
so if the droplets fall on them,
no, they cannot get infected, and they do not give it to the human beings.
Okay.
And regarding the treatment, as we isolate them, self-isolation is important. If somebody is developing shortness of breath or difficulty in breathing, they should come to the hospital so that supportive care can be given instead of staying at home. But if you just have mild symptoms like cough, fever, then you can just self-quarantine.
So how long do you have to be isolated or self-quarantined for?
It's 14 days if you have traveled to a country, as Professor Reena said. If you have traveled to a country which has COVID, then you self-isolate for 14 days. Or if you are developing symptoms, like the incubation period is up to 14 days.
Okay.
So you self-isolate for 2 weeks at home.
Then after that you can
come out, yes.
Okay, and I'm still just trying to. So if you self-isolate yourself for 14 days, then you do cure it and you work out free.
Yeah, if your symptoms are not getting worse, then you recover from it, and most of the people, they recover, as Dr. Dean was telling, that 97% recover. Few people will deteriorate, so they will recover. And when you are self-isolating, it's like you should not use the same bedding, it's advisable to use a separate bathroom, washroom, and the utensils. The beddings also be different. You don't mingle with people. Nobody should visit you unless really required. All those are measures for the self-quarantine.
Brilliant. So, so many questions are going through my head right now, and I'm sure going through your head also, And someone once told me, wash your hands. I mean, you've been reading that everywhere, all over social media, there are posters, wherever you see, wash your hands. Are we doing that properly? We'll find out more about that. And also, how long is this virus going to surface for? This and so much more right after this break.
Irresistible recipe, rich and creamy. MacCoffee Cappuccino di Torino, coffee with Italian character.
So, Dr. Mujahid, how long does the virus surface for? How long?
This virus, Shaheed, actually is quite a hardy virus compared to many others. And it's a big virus from a viral standpoint. And a lot of studies have shown that it can remain certainly for a few days, depending on the surface. On steel and metallic surfaces, maybe slightly less. On fabric and on leather and plastic, it can be several days, which is actually quite alarming. Which means that it could possibly infect someone 2 or 3 days after someone who was infected coughed on a particular surface. So I think the emphasis here is that fair enough, if it's there, we must protect ourselves. So surfaces need to be cleaned. And perhaps I can mention it now, that the single most effective measure for prevention of transmission is hand cleaning or hand sanitization in medical terms. And hand sanitization is achieved either by good hand washing technique with soap and water. And I'm sure you've heard it on media that we're talking about 20 seconds. Or what is 20 seconds? They're saying happy birthday for a couple of times, and that's 20 seconds.
So, Dr. Mujahid, when the show started, I used a sanitizer. Did I do it correctly as such?
It wasn't a bad effort, Shaheed, but I think let us show you let us show you the recommended technique.
And I know they say that the best. I know I was at a couple of days ago, and the professor was saying that the best way to learn it is through a surgeon.
Yes, so you need to come to theatre with me one of these days.
I think let's just watch this clip of Dr. Mujahid showing us how to wash your hands perfectly.
Search for years, but you lose everything you find. Braille for the deaf and a signpost for the blind. It's heaven for the cruel, but the devil waits for the kind.
So that's the perfect technique.
It's one good technique.
Technique.
Yeah. And if
is it a standard technique everybody uses?
Not really. I mean, there's standard recommended areas that must be covered, as was shown in that little clip. But I think if one makes sure that all those nooks and crevices in our hands are covered, then we're okay. I think, Reena, you wanted to say a bit about washing with soap and water.
I'm just,
which is your preferred choice?
Soap and water.
Soap and water.
But I was just looking at the media and how hand sanitizers are selling out. I just wanted to say washing your hands with soap and water is better than using a hand sanitizer.
And why is that?
Because it gets rid of more germs. Your aim is to get rid of the bacteria, the germs on your hand, and this is just a better way of getting, and it's proven. And that's why when doctors operate, they wash their hands with soap and water. They don't only use sanitizers. So yes, get your sanitizer if you don't have access to running water, but soap and water is better.
You know what's going on digital platforms everywhere, that this there has to be a bit of alcohol involved in it. That's why I get sanitizers, which have got the alcohol ingredient in it. What about that?
Yeah, no.
Is it just a myth,
I
or
think
is
it's just. I mean, if for the sanitizer, yes, you have to have the alcohol for it to work.
Yeah.
But otherwise, soap and water is equally good. And I think Swati had a really good comment about the surfaces.
Yeah. The surfaces, the most common thing we use is a phone. Everybody has a phone, not one. Some have more phones. Then when you go to the public places, also the bathroom knobs, even at home, the door knobs, the bathroom knobs, table surfaces. Yeah, all this should be cleaned every day with disinfectant.
Should be cleaned every other hour now, you know.
Yeah, the more cleaning it is, it's better it is, you know, so that we are more safe. And nowadays we see people are wearing gloves also, you know. But gloves again, if you touch the surface, you are touching your face, is the same thing. So it doesn't protect you more. But nowadays, if you go to the restaurants, you will see the guard who is standing there is wearing gloves and giving you.
I think the key, Shaheed, if I may add, is that once you touch the surface, it doesn't enter from your fingers. You then have to touch what we call mucous membrane, which means lips, inside of your nose, or perhaps eyes. So the key is first you get it by touching, and then if you touch your face, the mucous membranes, then the virus gets a chance to enter your body.
I think that's a very important point.
I think it's a crucial point, and probably as you've seen, there's almost a hysteria about masks. Now the good point about masks is that it may prevent you from touching your nose and mouth, but masks as such do not prevent because it's not airborne.
So who should wear the masks and the gloves? I think everybody's wearing it now, you know.
Masks should be worn by the person who is infected, or those people who are taking care of infected people. The general public does not have to wear masks.
If somebody is having symptoms, say cough or sneezing and all, they can use the mask and all. And the mask also should be disposed after use, or if you are using tissue.
All these masks have a shelf life.
Really?
Yeah. So like if you use an N95 mask,
it's not a one-off investment.
No. So if you use an N95 mask, if you use it for 24 hours, you have to throw it away. For us doctors, once we use it once, when we examine a patient, then within 24 hours it has to be discarded. Surgical masks after every surgery is thrown away. So people who are buying masks and keeping them for weeks, it's not going to help. So please leave the masks for the people who are infected and for the healthcare providers, please.
And especially this N95 mask, maybe we can put a clip of it. This is a very bulky, expensive and uncomfortable mask to wear. It's designed for health workers. It is not a mask that everybody needs to wear.
I think this is serious knowledge which people need to know that.
And even for us, when we wear the N95, within 10 minutes you're literally suffocating. So for those of us who use it, so people who are buying it thinking, when the epidemic comes, we'll wear it. You're never going to be able to wear it for a long time.
If you know one of my friends, I told them that I'm going to interview the three of you, and she was like, make sure you ask one of them this question. So it's with cases of people who are positive but didn't show the symptoms. How did that happen, and how do you get tested for it as such?
So 99% of patients who are positive had symptoms.
Okay.
So even from mature epidemics. So we say it's really, really unlikely that you can be positive and not have symptoms. Or develop them later. So they may be negative but they may be positive but develop the symptoms later, but they develop symptoms. Right. But talking about testing, can I just add, because that's another real common question.
Yes, please.
Who should get tested?
Who and how?
So only the people who have symptoms get tested. And the reason is the virus, when we do a nasopharyngeal swab to look for the virus, it's something that we put up in the nose. It's not a blood test. We put in the nose, it's a swab, and then we send it for PCR to our lab. It picks up virus from our mucous membranes, what Dr. Mujahid was referring to. So you need infection in the mucous membranes. Now, if you're asymptomatic, if you don't have cough, you don't have fever, you don't have the virus there. So if we were to do a swab on somebody who's not symptomatic, it would come negative. Right? And they may get this false sense of security. And that is our worry for testing everyone. Because we can test everybody and say you're negative, but they can still develop symptoms. The incubation period of the virus is 2 to 14 days. So if I get infected today, I can develop symptoms anytime from 2 to 14 days. So there is a window when I will not have symptoms. But if you were to do the test on me, I could be negative. So I'd have a false sense of security. So only have the test when you're positive. The other thing is also rationing the tests. The world over, there's a certain number of test kits. If everybody starts getting tested, we're going to run out of kits.
I think this has been in the media for a long time now. Last few days, every time whoever has come into contact, go and test yourself, and the test kits are very few, and it's not required actually to get tested unless you really have symptoms. And most of the countries, I think they are also doing the same thing, self-quarantine if you have mild symptoms, unless you are really bad, and then you go to hospital and they are testing.
So self-quarantine and social distancing is the same thing?
Self-quarantine is you stay at home in a separate room possibly, and you do not mingle with others, and your bedding, washings has to be washed, and separate washroom as I told, and no visitors coming in. That's self-quarantine. Social distancing, you are not going to the gatherings where more than 10 to 15 are people. You're not going to the gym or recreational facilities or hospital unless really you are sick, not for elective checkups and all that thing.
So just to add to that, social distancing is what we all should be doing now. Well, that's what the government has said, that everybody in Kenya now should do social. So don't go to weddings, don't have social gatherings, stay at home, work from home if you can. And if you're quarantine is like somebody who's coming in. So my son is flying in tomorrow from the UK. He will go into quarantine for 2 weeks at home, meaning he will not interact with anybody. I'm still going out, but he'll not be going out. He'll be in a room at home. His beddings will be different, utensils will be different. And it's very important because people are mistaking those two things, And also let me add, social distancing is not, it's actually a physical distancing. Let's not move away from our family and friends because we need our social, humans are social animals. We need to interact with everybody.
That brings, what if it's a family setting, What if all of you are there, and how would you avoid it?
Like if you are symptomatic or if you have traveled, you wear a mask while talking to them. But if you have not traveled and you are just like social distancing, you are at home, you can have a family thing. So and more than 10 to 15 people more than 10 to 15 people should not be together.
Although now I think they're not giving a number. Because as the epidemics increases, we're not giving a number. We're just saying as much as you can. Even if it's just 2 of you, or if you can even be alone in your room, it's fine.
I think, Shaheed, what you were alluding to is a lot of our population may be sharing rooms and even 3-4 to a room. So I think the issue is one has to be reasonable and you try your best. You can only do what is possible. I mean, if you are 4 people sharing a room, you're not going to kick 3 people out because one person is symptomatic, but perhaps you can have him in one corner. Maybe you can all wear masks. Make sure he's washing away from you and try to interact with him at a distance, him or her. But I think perhaps the concept we have of social distancing, you have a nice big apartment and one person is locked up in one room. That situation is not going to exist in a lot of our population.
That's true.
So we have to be reasonable.
But I think you need to also risk stratify. If you have elderly parents or you have people who have other conditions that Dr. Swati spoke about earlier, then and there's somebody who's got symptoms, you've got to move them away.
So you have to be harsh and just say, hey, this has to be done. Do what needs to be done.
I know it's tough, but maybe friends or use your extended family.
And
just 2 weeks.
Just 2 weeks.
Just 2 weeks,
Good. So guys are shopping like mad right now. Everybody's stocking up and everything. I mean, how is that? And before I get into that, the question was about toilet papers. They are being sold out left, right, center, apart from hand sanitizers. Why? How is that linked to all this?
You want to take this one?
It's definitely not transmitted by stool or feces. It's not transmitted. So I mean, I think it's just a sanitization. And people use water also. Some people use water. Some people use tissues. And I think that's the
There was this was an example of mass hysteria. There was a very nice article on panic buying, in fact, on one of the large news channels. And it's a psychological issue. When you are in a stress situation, you can actually get mass hysteria. I think the whole issue about buying toilet rolls was mass hysteria. I mean, surely that was the least of anybody's problems during that time. I mean, when you're sitting away from that situation, you say, what? Is that what they're worried about? And but there are people who have studied mass hysteria, and this was a classic example. So I think this can happen when someone goes to a shelf and sees there's a lot of toilet paper around. He say, fine, I'll buy one. But if he only sees 3, he says, let me buy all 3. So I think this is a lot of this is psychology, which I think we must educate our people that sure, I mean, I think you're asking about mass buying. I think at this stage, surely there's no need for that. Surely.
But you need to stop.
Do you agree with
totally
that?
agree, yes.
Yeah.
Because even in mature epidemics where patients are infected and they're having high mortality rates, supermarkets are not closing down, they're well stocked, fresh fruit and vegetables available. So I think just calm down.
Yeah, and our economy has to move, isn't it, Reena? I mean, the manufacturers have to manufacture and we'll buy it. The producers have to produce.
So talking about the same stuff, food, frozen food or buying food from the supermarket and everything, is that something you have to be careful about also? You've bought the stuff, you brought it home, and can you be infected through that as well?
Frozen food?
No.
Yeah.
I don't think there's any evidence to that.
Yeah.
I mean, of course, when the epidemic
The
started.
message is going around, clean all the breads from the shelves when you bring them home. And,
I don't know. We have to look at evidence-based advice.
Yeah.
Of course, they say the case 0.
Yeah.
It's still a mystery man, apparently.
Yeah.
But the case 0 perhaps may have got it from a live animal.
Wow.
Somewhere in November, December in China, as we all know. But to now speculate about things which are not yet proven, I think we shouldn't speculate. I don't know, is there evidence about frozen?
No.
I'm not aware of any.
In the live animal products, we should avoid direct contact. But if it is cooked and all, there is no evidence that it can transmit this coronavirus.
So if
I think they're talking about the packaging, whoever's handled the packaging.
Yeah.
No, I don't think there is any evidence
There's
for
no
that.
evidence.
So there is no
There is-
evidence.
So if it is on a live packed food or something, and it's been coughed on, and the droplets are there, once you cook it, you're safe.
Yes.
It dies out then.
Yes.
Okay. Now it's just a few hours ago. Mosques are closing down, temples have shut. And again, it's rule of social distancing. Everything it's affecting the community. What are your thoughts on that?
I think our country as a whole, and I think the religious leaders have acted very prudently. I think the idea is that we should stop mass gathering of people, be it weddings, funerals, parties, and certainly prayer gatherings. I think in all faiths, communal praying is done regularly in all faiths. So I think most leaders have announced that there's going to be no communal praying. And I think the issue is twofold. If one is infected and doesn't know, and then goes to a prayer, to a mosque, he is going to infect several other people there. And as was said earlier on, that this virus is highly infective. And if you're not infected and somebody has coughed on the prayer mat where you're going to put your head and nose, you are going to get it.
Yes.
So I think this is, I think it's important that this be emphasized.
So on the same note, we should stop going to malls and cinemas and this and that.
So they said reduce your going out as much as you can. I mean, leave it to essential.
Yes.
Essential going out. If you have to go, yes, but come back quickly. No hanging around. No, like come with me, my friend. We'll go shopping together. Just for some time. If we can stop that, that's the advice we would give.
Dr. Swati, what would you like to say on that?
Yeah, the public awareness regarding this is very, very important, and it's very important that we don't go in a mass to the supermarkets and all to buy stuff. So many people around. You can limit the numbers and you go and buy your essentials and all that thing, so that you are not deprived of anything, but you still have your this thing. And regarding like people have internet, they can still talk to each other and all.
Yes,
I mean, as they stay at home. And I saw some actually nice media ones, prayer for the whole world. Online prayers are going on for most of the religions now, and that's a good thing.
Yeah, I
think
prayer and all.
Like a lot of our meetings at the hospital moved to Zoom links, so you sit in your offices and you go in by Zoom. So I think human beings are very innovative. We're going to find different ways of praying, doing our work.
I know. I was watching one of my friends in Canada, and she was teaching a dance class via Facebook Live. She's like, we couldn't go to the hall, but everybody's live and watching it and doing the same thing.
Even the schools have gone online. Exams are online in most of the countries.
True. So in a way, it's also bringing out a different side in a positive way as well.
Yes.
Yeah. So once you're locked in, I think guys should just keep themselves active and do something. Don't get like a cabin fever kind of stuff over there. Learn a new skill or something.
Yeah, so maybe there are lots of online yoga lessons, aerobics. Some of the museums of the world have put their art on free online, so you can actually Google it. So there are lots of things to do. And like I said, humans are very innovative. Also to add that you can get some pharmacists do home deliveries of medications. Stops you going to
on a lighter note, some husbands have not spent time with their wives for such a long time. Also the kids, you're not used to having them at home throughout. So spend some quality time like
Absolutely.
that.
Something you've always wanted to do, so you have time to do it now.
Do those things which you said you didn't have time
to do,
Indulge in your passions.
Yeah. As the world heals, do yourself some good as well. So last parting words from each of our guests today before we say bye to them.
Yeah, so thank you for asking me to come to this show. I think my parting message is that majority of the patients, more than 80% of the patients have very mild, so even if you get corona, more than 80% of you will have very mild symptoms. So don't be so scared. The people who should be worried are the elderly, people with comorbids. Stay away, don't go out. The social distancing is a very important message. So for the next few weeks, as we weigh this epidemic and let it run its course, stay at home, do the things you always wanted to do at home that you were not able to do, and help us healthcare workers serve you better.
Well, thank you, Shaheed, for having us on your show. I would like to say that we are living in a time when there is so much information, but I think it's very important to have the correct information, and we are bombarded with messages about various aspects of the epidemic that we are concerned with, and I would ask our listeners and viewers to look at every piece of information with science and make sure you sieve the truth from whims and rumor. Don't perpetuate false information. I think it's very important for us to listen to the expert opinions. There's so many experts, and there's the World Health Organizations, there's the CDC, and there are our local senior members of the community, medical community. We must listen to them and take advice from them. And I think last and definitely not least, let's have faith. I think faith will take us through this period.
So thank you all. I hope you enjoyed the show. And my parting message will be, don't panic, be kind, be supportive, let's support each other, let's stay at home and talk over the phone. Instead of going to each other's house or going out. And lastly, as Dr. Mujahid said, have faith, be positive, things will be okay.
So there you go, guys. A very interesting episode we had today. Professor Reena, Dr. Mujahid, and Dr. Swati. Thank you so much for your time. Do watch, and as they say it, have faith. All will be fine. Once again, thank you so much for watching. It's the SAK Show, proudly brought to you by MacCoffee.